and sharing your experience with us here at this office. What effects did your problem have on limiting your daily activities?
It gave me extreme limitations, and I was constantly on pain medication.
When your problem was at its worst, how did it affect you?
Oh, it was very debilitating. I couldn't bend, I couldn't lift. I had to go up steps one at a time, hanging onto a banister.
Were you concerned that your problem was getting worse without any care at all?
Definitely. It was definitely worsening.
Were you told that you had to live with your problem or turn to drugs or surgery?
Yes.
What were the factors that led you to seek the care here at this office?
Because of my faith in chiropractics and the knowledge of what a fine man Dr. Kurtz is.
What influenced you to come to our office?
The need for help. Get off the pain medication.
And how did you hear about us?
I read about it first in the newspaper, his advertisement in the newspaper. And then we went to one of his presentations. It happened to be the one out at the library here in Kennewick. At the first conversation, he didn't think he would be able to help me because there hadn't been a track record set for spinal stenosis. That's a tongue twister. But I thought, he's a great chiropractor, and so I knew he wouldn't be doing something that he hadn't investigated and knew that it would work. And after my first treatment, I have not taken a pain pill to this day since.
Really good. What's been your experience here in this office?
Exactly. My experience here was nothing but kindness and caring and helpful people.
Why were you glad you came to this office in particular?
Because of the immediate relief and because of those who were here and how accommodating everyone was and how efficient the office was run.
I know you shared it already with other people because we've had patients show up, but what would you tell another person with the same problem that you've had?
I would tell them it's worth a try. And Dr. Hazel, when I told him what I had done, he said, just keep doing it. And I said, but it's too expensive. When Medicare doesn't pay any of it, hardly any of it. And he said, well, you're back where you were then. You just keep going until it's so painful you can't stand it any longer, and then we'll do the surgery. So that's where I am, and I'm still not on pain medication.
Yay. And what do you like most about coming here to this office?
Oh, I always feel like I'm the only patient